Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Cortney Yohn. She is a coordinator with the Maternal and Child Health Program, but she's also a public health social worker. And we're talking about Child Abuse Prevention Awareness Month, which is every April. So, Courtney, thank you for being here.
Thanks, James.
This is a pretty heavy subject, pretty heavy topic. There's some pretty staggering stats that you've got that you're going to give. So I'll just let you get right on into it. So please tell us, why we observe April as this.
Okay. So April is Child Abuse Prevention Awareness Month. The theme this year is Growing a Better Tomorrow for All Children Together. You see, I have pinwheels beside me. We are going to be planting a pinwheel garden at each of our sites. The symbolism behind the pinwheel is to represent the innocence and reflect the bright future. That's what the pinwheel does. And the Children's Trust Fund believes that it shows a chance for healthy and happy life for all Alabama's children. I have these pinwheels here. This is just an example of what you'll see. We do want the community to recognize what we're doing. So if you could get the word out that it is Child Abuse Prevention Awareness Month. I'm wearing blue as a result, like we did April 1st.
Mhm.
And this month I plan to wear blue a lot. And we have some other activities lined up this month to help get the word out. I have some statistics about child abuse awareness in Alabama. Um, According to alabamapublichealth.gov, child abuse and neglect are important health issues for Alabama. Child abuse is defined as harm or threat of harm to a child's health or welfare. Child neglect is negligent treatment or maltreatment of a child, including the failure to provide adequately for a child. Um, During 2018, our CPS agencies received an estimated 4.3 million referrals involving the alleged maltreatment of approximately 7.8 million children. More than half of those were screened in for investigation by the CPS agencies, and approximately a fifth of those were found to be victims of abuse or neglect. So, about 61% of victims suffered neglect. Um, Almost 11% suffered physical abuse, 7% was sexual abuse. There was a small percentage that was psychological maltreatment, and there was a small percentage of medical neglect. So, some of the risk factors for child abuse and neglect are drug and alcohol use or abuse of the parent or caregiver. And nearly three-quarters of the children who died from abuse and neglect were younger than 3 years of age. So, if you see something, say something. If you suspect any kind of maltreatment or abuse, please report it to Mobile County DHR. And that phone number is 251 450 7018. You can also call your local law enforcement agency. The age of majority is 19 in Alabama, so reports are taken for abuse and neglect of children up to that point, up to age 19. Two-thirds of all the reports made are by professionals. We are mandated reporters, medical staff, social workers, nursing staff. So I know that we take trainings that talk to us about mandated reporting.
Mhm.
So if you don't know, ask someone. If you do see something, say something.
Excuse me. Yeah, that's like I mentioned there at the beginning. Those are some pretty staggering statistics, which means that we shouldn't be turning a blind eye. We know that this is happening, not just in the state of Alabama, but this is happening throughout the United States.
Right.
And like you said, we do go through a lot of training and we are mandatory reporters. And it's not just the medical community that's responsible to be reporters, that's anyone. That's, teachers or Sunday school teachers, or
Yeah.
anybody else that works with children, somebody in a Boy Scouting or Girl Scouting program, or anything like that, after school sports activities. It's for the overall well-being of the child, so it is in the child's best interest that you know some authority is contacted somewhere on that child's behalf. Um, can you give that number again for Mobile and Mobile County for reporting?
Sure. For the Mobile County Department of Human Resources is
Mhm.
251-450-7018.
Okay, and also, we have social services here as well
Mm-hmm.
at the health department. So we also have behavioral health services too. So um, if your child needs help, or if you need help dealing with different situations, you can also contact us here at the health department to make an appointment. It's 251-690-8889. We can get you referred to the right department underneath our roof to be able to help you or your child or both of you. um, you talked about 1% of children excuse me, or nearly 1% suffer some form of medical neglect. Um, you know, Children need to go to the dentist twice a year. They need to go to the optometrist once a year. And, they need to go to the pediatrician for regular well child checkups, for immunizations, not just to the doctor when they're sick. So, um, parents and caregivers shouldn't overlook those benchmarks in a young child's life.
And we provide those services here at the Mobile County Health Department. So, if ever there is a question, we would really encourage you to call. We provide so many services throughout this county that a lot of people aren't aware of.
Mm.
So, even down, I'm also the lead program coordinator,
Mhm.
and your children need to be tested for lead. If we find that they do have lead in their system and that's not rectified, then that could also be a form of neglect. There are so many things that, as parents and caregivers, we're responsible for, and children are totally dependent on us to
Mhm.
do what we need to do to make sure that they are safe and cared for.
I couldn't agree more. Thank you for speaking on Wellness Wednesday. This was a pretty somber Wellness Wednesday, not one that you and I are normally used to. We're
Right.
usually a little bit more upbeat about the things that we talk about, but this is a serious matter, and it matters also the other 11 months out of the year too, and not just in April.
Exactly.
So, um, Courtney, we thank you for being on Wellness Wednesday, and we hope that we're able to reach some people out there that need those numbers and need that information.
Thanks.
Thank you.